In Epidemiology Part 2, we will be describing how the virus has spread throughout the world and how the U.S. has failed to control the spread of COVID-19. The outbreak began as a point source in Hunan live animal fish market, and the majority of cases were among market workers depicted in yellow. However, within 10 days, the disease rapidly spread person to person to those who had not been in the market, the blue bars, demonstrating early on that this virus was highly infectious. There is some debate with regards to when the outbreak began in China. Some suggest a larger number of asymptomatic carriers were spreading the disease before the publicized December outbreak. As discussed earlier, it has been suggested that the outbreak began as a laboratory accident in the Wuhan virology lab. Given the delays in the investigation and the secretive Chinese government, the true source of the outbreak is unlikely to ever be definitively determined. These maps document the rapid spread throughout China. Each 10-day interval documents spread outward from the city of Wuhan, where the market was located, into the entire Hubei province and progressively into the other eastern provinces. The infection quickly spread throughout the world as a consequence of Chinese citizens traveling to Europe, particularly to northern Italy, and tourists infected while visiting Italy then spread the virus to New York City. Chinese also traveled to Seattle, explaining the first outbreak in the U.S. As shown on this map from the Center of Systems Science and Engineering, Johns Hopkins, as of January 6, 2023, there have been nearly 664 million cases and 6.7 million deaths, for a death rate of 1%. The U.S. continues to lead the world with 101 million cases, followed by India with 45 million cases and Brazil with 36 million cases. Why is the U.S. leading the world in cases? The simple answer: failure to act. To illustrate the importance of early intervention, I commissioned the famous artist and family friend Bruno Lucchesi to draw an image of Pandora's jar. Zeus, angered by the deceptions of Prometheus, warned that a great plague to you and yourself and to men shall be. He created Pandora, a beautiful maiden, and fashioned a jar, often mistranslated as a box, containing all the pestilence of the world. He encouraged the curious Pandora to open the jar, releasing a plague on all men. 3,000 years later, we are now experiencing such a plague in the form of COVID-19. And when politicians delay applying the tools of infection control, they are leaving Pandora's jar open, allowing the virus to spread, causing unnecessary suffering and death. These are the epidemic curves earlier in the pandemic for South Korea, China, all the European countries, including Italy and Spain, the Scandinavian countries, Australia, and the United States. The vertical axis is a log scale of the number of deaths per day from COVID-19. Each star represents the time at which the government implemented shelter in place, that is, when they closed Pandora's jar. Look at South Korea. They implemented shelter in place and aggressive diagnosis, case finding, and isolation after observing 3 deaths per day. Note the nearly flat curve for South Korea, pale blue. Also notice that during that time, the number of cases dramatically dropped in China, orange curve. They intervened after 3 to 4 deaths per day and after a total of 30 deaths. Italy, black curve, on the other hand, waited until the daily death rate was 75, and they had accumulated a total of 800 deaths before ordering shelter in place. Note the steep curve as a consequence of leaving the jar open. Italy has had the highest number of deaths of any European country at that time. Finally, note the steep curve for the U.S., red. The U.S. did not implement a uniform policy. Some states sheltered in place, others choosing not to intervene. The consequence of this approach? We have by far the largest number of active cases and deaths in the world. To make matters worse, we reopened states who chose shelter in place in early May, and many have ignored recommendations to wear masks. Here are the current epidemiology curves for the United Kingdom, the United States, and India. The vertical axis is the number of daily cases per million, a 7-day average, and horizontal axis days. Note the steep rise of the Alpha variant cases in January of 2021 in the US and the UK. In the US, too many people ignored CDC recommendations to stay home for the holidays and traveled to visit family for Christmas and New Year's. The peak during that period was 270,000 cases per day and 3,000 to 4,000 deaths per day. Both the UK and US cases dropped the next spring, and it was during that time that cases in India rose to very high levels due to the Delta variant. At that time, the Indian government relaxed infection control measures and permitted large religious gatherings, leading to explosive exponential growth of the virus. Despite being a leading manufacturer of vaccines, less than 2% of their population had been vaccinated. In June, there was a sudden drop in the cases that is not completely understood. India has subsequently aggressively vaccinated its population, and to date they have had no major surges that again have overwhelmed their health system. The Delta variant subsequently spread to both the UK and US, causing summer surges. And last winter, the UK and US experienced a massive winter surge due to the emergence of the Omicron variant BA1. Note the extremely steep rises in new cases in both countries, reflecting its extremely high reproductive rate and doubling time of 1.5 to 3 days. Following the first massive Omicron peak, there was a modest surge last summer due to the BA5 Omicron variant. And presently, both the UK and the US are seeing modest rises in cases due to two new subvariants, BQ.1.1 and XBB 1.5. Total cases in the U.S. have nearly doubled from 52 million in January 2022 to 101 million as of January 5, 2023, and deaths from COVID-19 are now over 1 million. The U.S. represents 4% of the world's population, and yet we have over 16% of the world's cases and 16% of the deaths due to COVID-19. Los Angeles now has the largest number of cases with 3.6 million, followed by Phoenix, Chicago, New York City, and Miami areas, all with 1.5 million cases, followed by Houston at 1.2 million, and the original epicenter of the U.S. outbreak, Seattle, having a much lower number at 538,000. This map, generated by the CDC on January 5, 2023, shows COVID-19 activity for each region. Orange represents high activity, yellow medium, and green low. Because home antigen tests for SARS-CoV-2 are now widely available, cases reported to the state health departments are not an accurate reflection of disease activity. The CDC now uses 3 values to determine the activity of COVID-19. Incorporating the 7-day total of reported daily COVID-19 cases per 100,000 population, new COVID-19 admissions per 100,000, and the percentage of inpatient beds occupied by COVID-19 patients, a 7-day average. As you can see, the Northeast, Mid-Atlantic, and South regions of the U.S. now demonstrate high activity. As will be discussed in Module 3, in the vaccine section, routine 2-shot vaccination affords only a low-level protection from the Omicron variants, 33% efficacy, emphasizing the importance of receiving the bivalent booster containing both the native and BA spike protein sequences, and wearing N95 masks in public spaces. This bar graph shows the breakdown of percentages of the various Omicron variants over time in the U.S. In October of 2022, BA5 was the major subvariant, but now BQ.1.1, 27 to 43%, and XBB 1.5, 14 to 46%, are predominating, followed by BQ1, XBB, and BA5. As shown in the right figure, in the Northeast, XBB 1.5 is now the major subvariant, accounting for 62 to 80% of infections. Finally, a few words about the latest threat to the world's ability to control COVID-19. China's flawed approach to managing the pandemic. The centralized government insisted on a zero-COVID policy that consisted of frequent lockdowns, infection control measures that mandated infected family members be quarantined in government facilities, and a failure to aggressively promote vaccination. Although early in the pandemic, strict isolation policies were appropriate, over time, with the release of vaccines, these policies should have been modified. The consequences have been severe psychological and financial stress. The lack of exposure to the virus and the low vaccination rates among those over 65 have resulted in a low levels of herd immunity. The onset of Omicron surge began in January of 2022 throughout the world, and by February this highly contagious variant was causing a rise in infections in China despite zero COVID policies. Note the weekly infection rates of 500,000 cases and 2,000 deaths per week during this period. The Chinese government responded by more stridently enforcing their overly aggressive infection control policies, resulting in massive protests opposing the zero COVID policy in November and early December. On December 7th, the government suddenly ended all infection control policies and is now allowing their citizens to travel throughout China and the world. As you see on the right side of the bar graph, a second surge of Omicron is beginning in China. The severity of the surge is unknown because of the lack of meaningful data from China. With high infection rates in China, there is a high likelihood that new gain-of-function Omicron mutants will be generated in China and spread to the rest of the world. To summarize the content of this video, the epidemic began as a point source outbreak in a live animal fish market in Hunan, China, or possibly following a laboratory accident at the Wuhan Virology Lab. As of January 6, 2023, worldwide, there were over 664 million cases and 6.7 million deaths. Many countries early on experienced exponential epidemic curves because of delays in implementing infection control practices. Pandora's jar was left open. However, most countries have established policies to effectively control the epidemic, except for the United States, where politicians insist on blocking scientifically based infection control measures and vaccine promotion. These policies explain why the U.S. leads the world in the number of COVID-19 cases and deaths. Omicron variants capable of infecting a high percentage of vaccinated individuals have resulted in surges of infection last winter. New Omicron variants BQ.1.1 and XBB.1.5 are capable of evading prior immunity and are now causing modest rises in cases in the U.S. and Europe. China's zero COVID policy has led to undue financial and social hardship, resulting in massive protests. The government has now lifted all infection control measures, and the likelihood of a major surge in China and the possibility of new, more contagious Omicron subspecies are a major concern for the world.